Good afternoon, everyone. I'm Srinivas, and I'm a senior AI scientist at Vadwani AI. Okay, while the slides load, a quick show of hands. How many of you are parents to young kids here? Yeah, quite a lot of you, right? How do you think kids are weighed? How do you find the weight of a child? If anyone wants to answer? Yeah, very obvious, right? You just place them on a weighing machine and you get their weight, right? Let's see how this person weighs this baby. Yeah. What we consider a weighing machine as a luxury, this is how kids are actually weighed in a major portion of our country. As you could see, there's this sort of a spring balance. Half of the baby is hanging out. The mother is scared. She's trying to support the kid. The health worker who's weighing, she is not very confident of lifting the baby either. Several other problems like, broken springs, incorrect weighing scales, and so on. India has a very high neonatal mortality rate, roughly about 25 for every 1,000 births. This number, of course, is higher in rural parts of India as opposed to the urban part of India. And neonatal mortality has been directly correlated with low weight. Now, interventions are possible, but it's only possible when you're able to accurately weigh your baby. There are programs in place. The National Health Mission and several other organizations have put out protocols on how you go about weighing children. But due to obvious issues like the one that you just saw in the previous video, you don't get an accurate measure of what's the reality in the ground. And because of this, several newborns go without any intervention, and most of them succumb to their illness. Predominantly malnourishment, which of course leads to a host of other issues. Health workers using these sort of spring balances, which are basically Salter scales, these are called Salter scales, are just one part of the problem. They are uncalibrated, you have it's a poor instrument, it's uncalibrated. That's just one part of the problem. The other part is that, to cover the length and breadth of our country, they often have to carry some of these equipment and walk miles and miles across rivers and mountains sometimes, go into extremely remote parts of the country to really get access to children. A consequence of that is, something like you see here, data fudging, really. If you can look at this board here, this is, a board which says that every baby that's born is having a birth weight of 2.5 kilograms, accurate to the third decimal even, which is fishy, right? So yes, this accountability, the recording and accountability is a huge problem as well. So what are we doing really to solve this? So our mission is to accurately identify underweight newborns and monitor their growth using an AI-based anthropometry tool that we have built. So the conventional apparatus, as you can see in this figure, the Salter scale spring balance that I spoke about. We also have these infantometers, which they use to measure the length of the child, to measure other important parameters like the chest circumference and the middle upper arm circumference. So this is the conventional approach, and what we are aiming to do is to really replace that with a very, very simple smartphone-based application, which just takes a video of the baby, and you also use a wooden ruler and a smartphone-based application, which just takes a video of the baby, and we estimate several anthropometric features of the baby just by the simple video. And the way we have designed it is that this app is intended to work without any internet connection. So the AI model that we have runs directly on the phone. And of course, it's designed for the community and for ease of use for even health workers who may not be extremely technically proficient. So we'll probably have a quick look at what this app does. So we call it Shishumapan. So yeah, it sort of starts with a quick dashboard where yes, the ASHA workers typically, they add a newborn. They are trained to also take informed consent from the parents. So they explain the parents what happens and what the entire process involves. Some basic information about the baby is collected. And then they go into the recording process. So here, this is just some instructions for the ASHAs. So this is the main part where the baby's video is captured. What we aim to do is, the baby's of course blurred out for obvious reasons. What the Asha is instructed to do is to really take a video in an arc, and all of these oval overlays and the guides that you see on top are all after extensive consultation with end users for this product. So these have been meticulously designed. There's in fact also a voiceover to really guide the Asha so that she doesn't do it very quickly or very slowly. So the objective here is really that, yes, you take a video of the baby in an arc, and finally, yes, your machine learning model takes this video, looks at various frames of the video, and finally comes to, which we'll very shortly see. Yeah, so you get all of these various metrics, and there's a very specific protocol that's followed. And there are certain days in which you're supposed to be capturing the weight of newborns, and that's integrated with the growth chart, and finally also integrated into larger portals such as Portion Tracker, if some of you are familiar with it. So yes, this is really our solution, and just a few results. So of course, we're measuring weight. We need to be as accurate as possible. So I think the key numbers to look at are what we call the mean absolute error. This is how we quantify our errors. Mean absolute error is nothing but when you measure on a set of babies, you take the error in your measurement for each baby, and you take an average of that. So we achieve about 114 grams of error. And I think also important to see is that 83.2% of the visits we get an error of less than 200 grams. Now I'm saying 114 grams of error, but how good is this really? So we actually did a study for that where we sort of did it's a bit of an unpaired study and a very initial study that we did where the orange line that you see shows the conventional method of using a Salter scale to measure babies, while the blue line shows what our app does. And yes, to interpret this plot, yes, the closer you are to a perfect square, the better the method is. So clearly, I think we've been performing well, and now we're trying to do a more extensive study to get more confidence that our blue line is indeed better than the orange line. So yes, I think that's a little bit about that project very specifically, but People+ai as an organization, we do have a very wide healthcare portfolio, all of which are aimed at public health in India. So we have several projects in tuberculosis. We go all the way from mapping out very specifically where tuberculosis hotspots are, to identifying patients who are there. We screen them for the disease. And then we also try and figure out, once people are into the system, how, if they are at a loss of falling off from the system and falling off from their treatment regimen. We also do a variety of projects in decision support. A lot of work goes on in medical imaging, chest x-rays, diabetic retinopathy, skin disease classification, oral cancer, and so on. And of course, our maternal child health portfolio, the solution that I just showed, was specifically geared for babies of 0 to 42 days of age, because that's their most vulnerable period. But we're also looking to extend that to children under 6 years of age. So yes, this is just a few of the projects that I'm highlighting. If there's any interest in any of these and you would like to have a chat, I'll be around, so more than happy to have a chat. Yes, with this I'm going to close. So yes, thank you for your time.